Hello friends, we are from group 7 and this is our video about Biochemistry Practicum Urinalysis. We would like to say thank you for our lecturer, Mr. Ahmad Fahrurozi. And keep on watching friends. Let me introduce our group members. 1. Alivia Cahyani. 2. Amalia Nur Azizah. 3. Zahri Tsaqifa. 4. Wanda Nurfitri Rahmadani. The contents of this presentation are: first, urinalysis macroscopic and microscopic; second, biochemical urinalysis examination of urine glucose; third, biochemical urinalysis examination of urine protein.
Urinalysis microscopic and macroscopic. Inspection objective. 1. Urine volume. To know the urine volume of the patient within 24 hours, and it is useful to know the condition of the kidneys. 2. Urine color and urine clarity. To find out what urine abnormalities mean for the clinic and find out if the urine is murky or clear. 3. Smell of urine. To determine abnormalities in urine for clinical purpose. 4. Urine equality. To know the pH of urine and can also provide instruction toward etiology in the urinary tract infection tract. 5. Urine type weight. To know the weight of the type to be checked. Benefits. 1. Check the overall health of the body because it is often part of the examination of the health of the body. 2. Monitor the progression of the disease as well as success in the treatment process, for example, in kidney failure, diabetic nephropathy, urinary tract infection, and others. 3. Assess kidney function before surgery, monitor abnormal pregnancy progression, including dehydration, preeclampsia, gestational diabetes, and others. 4. Help diagnose certain medical conditions such as urinary tract infection or ESK, polycystic kidney disease, kidney failure, kidney inflammation, and other diseases. Principles. 1. Observe the volume of urine collected in the test tube for 24 hours. 2. Urine color is observed in the test tube with translucent light and seen in a hollow attitude. 3. Can be seen in the shaft attitude on the test tube with translucent light. 4. Degree urine likeness inset with liqueur as or indicator paper. 5. Testing is done directly using the nose. Materials. There are litmus paper, tissue, and urine sample. Tools. Centrifuge tube rack, centrifuge tube, test tube, measuring cylinder, hydrometer, test tube clamp, microscope, watch glass, urinometer glass, drop pipette, test tube rack. Macroscopic. 1. Urine volume examination. Performed at a certain time on the first day. The patient urinates and the specimen is removed. At the time the patient urinates will be recorded on the urine container. The last specimen was exactly 24 hours after the first pee was accommodated. All specimens have been carefully collected in a container for the next 24 hours. After that, measure the volume of urine using a measuring glass. 2. Urine acidity examination. Place the litmus paper on top of the watch glass. Drip a little urine using a drip pipette on litmus paper. Compare the color that is formed with the standard color. If the acid urine is, the indicator paper will be yellow, and if the urine is alkaline, then the indicator paper will be green.
Urine turbidity check. Put the urine sample in a clean, dry, and clear test tube. Negative, no noise. Positive plus, there is mild noise without grains. The rate is approximately 0.01 to 0.05%. Positive plus plus, the noise is easy to see and appears the granules in the noise. The rate is approximately 0.05 to 0.2%. Positive plus plus plus, urine is clearly murky. Levels approximately 0.2 to 0.5%. Positive plus 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 plus, very murky urine. Urine odor check. Fill 3/4 fresh urine on the test tube. Shake the palm over the test tube of the container containing urine sample until the smell of urine can be smelled. In general, the smell of urine is not strong. The pungent odor in urine is usually caused by food or drugs. In urinary carcinoma, urine will smell of ammonia because of the germs that break down the urine. Wanda, 2006. Severe examination of urine type. First, urine is at about 40 milliliters into the measuring glass. Second, gently release the urinometer into the measuring glass so that it is free from the walls. Third, rotated urinometer to be removed from the wall using thumb and forefinger. The last, after the urinometer floats in the middle, read the weight of the type without parallax on the lower meniscus. Microscopic. 1. Urine samples are homogenized first. 2. Then transferred into centrifuge tube as much as 10 milliliters. 3. Centrifuge with relatively low speed, approximately 1,500 to 2,000 revolutions per minute for 5 minutes. 4. The tube is quickly reversed decanting to dispose of the supernatant, so that the deposit is approximately 0.2 to 0.5 milliliters. 5. Deposits drip into the object glass. 6. Close with glass cover. 7. Deposits are first examined under a microscope with low magnification using a 10 times objective lens called a weak field of view (LPL) or low power field (LPF) to identify large objects such as cylinders and crystals. 8. Furthermore, the examination is used with high strength using a 40 times objective lens called LPK field (HPF) to identify cells, erythrocytes, leukocytes, epithelials, yeast, bacteria, trichomonas, mucous filaments, sperm cells. 9. Record all the results that have been pinned. Conclusion. Urinalization is examination of urine samples macroscopically and microscopically and chemically. The purpose of urinalization in general is to detect abnormalities of the kidneys, urinary tract, fibers to detect abnormalities in other organs of the body such as the liver, bile, pancreas, and others.
2. Biochemical urinalysis examination of urine glucose. Urine glucose test or Benedict's reduction test. The urine glucose test is an examination of the urine sample to determine the presence or absence of glucose in the urine. The indication for this examination is screening test for diabetes mellitus. A. Pre-analytics 1. Sample preparation. The sample urine must be protected from contamination. Collecting containers should be clean and dry. Sample identification. Name, number, address, age, and use of urine preservative. Urinalysis must be carried out within 2 hours after urinating. If there is a delay in the test, the urine should be stored in a refrigerator. Sample collection method used is random urine. Urine samples used for urinalysis are random urine, morning urine, and postprandial urine. 2. Principles. Urine is reacted with Benedict's solution urine glucose levels based on change in urine color. The tools is test tube plus rack, volume pipette, drop pipette, filler pipette, test tube clamp, and spirit lamp. The materials are 1. Benedict's reagent, 2. Abnormal urine, 3. Matches, 4. Tissue. B. Analytics. Work procedure. A. Prepare tools and materials. B. 2 test tubes were filled with 2.5 ml of Benedict reagent. C. Put 4 drops of urine in one of these tubes. D. Slowly heated on a spirit lamp until bubbles form. E. Lifted and shaken the tube and then cool it. F. Read the result of the reaction. G. Compare it to the other tubes, then see the difference. Post-analytical interpretation. 1. Observing result. Color yellowish green, positive or 1 plus 0.5 gram until 1 gram. Discussion. High sugar levels are removed through urine. Thus, the urine of people with diabetes which contain glucose so that they are often smoother or attacked by ants. Then the person will lack energy, young, tired, cold, thirsty, and hungry, often tingling, often throwing away urination hives, and so on. Less than 0.1% of normal glucose filtered by the glomerulus appears in the urine. Less than 130 mg or 24 hours. Glucosuria, excess sugar in the urine, occurs because the kidney their salt is excessive or the tubular reabsorption power is decreased. Glucosuria generally means diabetes mellitus. However, glucosuria can occur not in line with an increase in blood glucose levels. Therefore, glucosuria cannot always be used to support the diagnosis of diabetes mellitus. For the measurement of urine glucose, the reagent strip was given the enzyme glucose oxidase or GOD, peroxidase, POD, and dye. Normally, glucose is absent or present but in very small amounts in the urine. When the glucose level is very small in the urine. When the level of glucose in the blood exceeds the kidney sugar limit 106 until 108 mg, the glucose in the urine increases. The presence of glucose in the urine or glucosuria is an indication of diabetes mellitus. The presence of glucose in the urine is glucosuria. In essence, glucosuria is regulated by 2 factors, namely 1. Levels of glucose in the urine, 2. Renal their salt. 4. Glucose release. Fasting urine is usually 100 mg%. Their levels become high by food or carbohydrate. The kidney their salt. 4. Glucose secretion in most people growing up healthy is 180 mg%. The kidney their salt can increase or decrease, and even that also seen in diabetes. Conclusion: from the result of urine examination with the addition of Benedict's reagent and heating in a spirit lamp, it was obtained a positive result with a yellowish green color changes.
3. Biochemical urinalysis examination of urine protein. The purpose of the examination practicum. An urine protein test measures the amount of protein present in urine. Healthy people don't have a significant amount of protein in their urine. However, protein may be extracted in the urine when the kidneys aren't working properly, or when high levels of certain proteins are present in the bloodstream. The benefits of examination practicum: to see if a kidney condition is responding to treatment, if you have symptoms of a urinary tract infection (UTI), and as part of a routine urinalysis. Basic examination: your kidneys keep you healthy by filtering blood. They have small blood vessels called glomeruli. These structures remove waste which enters the urine and reabsorb protein that stays in the blood. But if your kidneys aren't functioning properly, the protein can leak into your urine. The result is high protein levels in the urine, known as proteinuria. The only way to diagnose proteinuria is through a urine test, which measures the amount of protein in your urine. Principal examination. Head coagulation test is one of the methods to check protein in urine. Head coagulation test is a useful screening test for proteinuria, especially in pregnancy. The principle of head coagulation test is proteins are coagulated on heating. Head coagulation test. Tools and materials. First, there is urine sample. Second, there is acetic acid. Third, there is spirit. Fourth, there is test tube. Fifth, there is drop pipette. And last is test tube clamp. Steps of the standardized head coagulation test. First, apply 5 ml of the urine sample into a test tube. Second, add a few drops of dilute acetic acid to the tube to make the sample acidic. Third, heat the urine column in the tube over a burner without boiling over. Last, compare the tube against the diagrammatic result interpretation chart and record the result. The diagrammatic result interpretation chart. There is negative or trace, it means no normal turbidity observed. Printed letters can be clearly read through the tube. There is +1, it means definite turbidity observed. Printed letters can be clearly read through the tube. And there is +2, it means definite turbidity observed. Printed letters cannot be clearly read through the tube. There is +3, it means definite turbidity observed. Nothing can be observed through the tube. And the last is +4, it means protein clots are seen in the tube. The discussion is head coagulation test for measurement of protein in urine. Albumin and globulin are coagulated by heat at an acid pH, and the amount of turbidity present provides a qualitative estimation of the degree of proteinuria. There are 4 levels, among others are negative or trace, +1, +2, +3, and +4. Conclusion: head coagulation test is not really hard to do when compared to other methods. There are 4 levels, from the lowest level, negative or trace, to the highest level, +4. The higher the level, the more protein there is in our urine. It means our kidneys is in trouble. Thank you for watching this video till the end. If you have any question, please comment below. Bye bye.